Hello, I'm Dr. Dean Fardo, plastic surgeon here at the Swan Center for Plastic Surgery. Today I'd like to talk about some of the common options we have for facial rejuvenation. We see a lot of patients who come in and just wonder what the options are and what we can do. And I think it's exciting because for facial surgery, there's probably more options and more choices we have to tailor an individual plan for patients than probably anywhere else on the body. So when I see a patient, I think it's very important to understand what their goals are, what their concerns are, and especially their lifestyle and how they want to approach their facial rejuvenation. Most of the time we start with the non-surgical and minimally invasive options, and these include the common things that people know, such as Botox or Dysport, or some of the common fillers such as Restylane or Juvederm, among others. These products have come so far in the past decade, and they're great options for the majority of patients because they produce a very natural, nice improvement without really any downtime or serious complications. So that's almost always where the discussion starts on facial rejuvenation. And if we can achieve a patient's goals without surgery, that's always a good option. Sometimes the minimally invasive surgical procedures are good options as well. And again, it really depends on a patient's concern, what their anatomy is, what their ability to take time off is, because we want to get everybody back to their normal life as fast as we can. And with surgical techniques that have developed over the past several years, it's really possible, even with procedures such as a facelift, for patients to go back to work within a week. And the goal of all of our facial rejuvenation really is a natural, non-operated look. If somebody knows you had facial plastic surgery, it's usually not a good thing. So that's really important, and I think that's how our specialty has changed really over the past 10 to 15 years especially, and that we want a very natural aesthetic outcome. And that's something that patients really embrace and do really well with. To summarize, I think the important things are individualizing a plan for a patient. It really depends on so many different factors, and that's something that only a consultation with your board-certified plastic surgeon can give you, is to go through what your options are from the non-surgical to surgical, to talk about developing a plan that encompasses your lifestyle, your goals, your ability to take time off, and your budget. That's all important to work together to come up with a detailed plan.